Good evening. It's Josh Goodwin here at Regenexx Las Vegas. I'm going to be giving the webinar tonight about regenerative interventional orthopedics. So as I said, my name is Josh Goodwin. I'm the doctor here at Regenexx Las Vegas. We're going to talk about regenerative interventional orthopedics. It's a mouthful, but we're going to talk about more what that is. The way that it's going to work, there's going to be just some introduction on myself, what Regenexx is, what we do here, talk a little bit about just orthopedic conditions in general, and then move more specifically into what we do here, how we make decisions on who could be candidates for the procedures that we perform, and how it can potentially help your orthopedic condition. This is one of our basic webinars, just giving a brief overview of this field of medicine, how we approach orthopedic care, how we make decisions, and just a little history about Regenexx as a whole. And then there is going to be time for question and answer at the end. People can type in questions within the chat section. I will address them all at the end. I'm not going to likely stop to address the questions in the moment, but I will get to all of them at the end. So feel free to stick around till then if you guys have specific questions. So just to move on for just a brief introduction. So I am a medical doctor. I am board certified in physical medicine and rehabilitation, and fellowship trained in sports medicine and interventional spinal medicine. I did my medical school training in New Mexico. I did residency in San Antonio, Texas, and then I did my fellowship training in Scottsdale, Arizona. I joined Regenexx in 2015. I worked at the Des Moines, Iowa clinic for 3.5 years, and then I've been at the Henderson, Las Vegas clinic since 2018. I am a co-author on a review article describing the use of stem cells for discogenic low back pain. And like I said, been a part of the Regenexx organization, focusing on some of the things we're going to talk about, with more interventional, minimally invasive, injection-based treatments, really focusing on what can we do to help preserve and improve your orthopedic tissue, whether it be from joint degeneration, or AKA arthritis, osteoarthritis, muscle tendon injuries, inflammation. We do treat a lot of spinal conditions here as well. In the future, we will have more dedicated webinars for kind of area-specific issues like spine, knee, shoulder, those kind of things, just to get in a little bit more detail. So we're talking about musculoskeletal disorders, and these are things that just affect, people of all age groups. Different types of orthopedic issues can happen in younger versus older, where as we age, we tend to get more overuse, more degenerative conditions, where younger patients might have more traumatic injury, but can also have degeneration, which we do see sometimes. So it does affect a lot of people. Many of us have had orthopedic issues, whether it be back pain, shoulder, hip, foot, whatever it is, traumatic injuries. And there is a significant economic burden by just taking care of these issues, both direct and indirect costs. And all of us know someone that's had or dealt with orthopedic issues. Traditionally, there are treatments that people utilize to get through, the time of pain or discomfort, which we'll talk just briefly about. Because it's important to just, have a good understanding of kind of the traditional treatments, and then where do we fit in with some of the more specific specialized treatments that we provide. which we'll talk more about in a second. So, traditionally, all of us have likely used non-steroidal anti-inflammatory medications or other pain medications to, help with orthopedic pain. While these can be very effective, we have to remember that, these are medications and then they do carry side effects, and there's black box warnings for risks of GI bleeding, kidney dysfunction, cardiovascular effects. And so we have to balance that with chronic use, the risk benefit ratio of these things, and make sure that if we are using them chronically, that we are being monitored and tracked and having labs and things to assess for complications that can arise from these types of medications. Obviously, a lot of us use them on a regular basis, but some of us may not realize that we are exposing ourselves to potential risk with chronic use. There's actually new data showing that chronic use of ibuprofen and Aleve type medications actually increase orthopedic pain when it's used chronically. You can also see that with people with chronic pain medications, where people get hypersensitization and actually pain increases as opposed to decreases. And that it can have an effect on long-term healing when used in a chronic way, because it's reducing inflammation that is involved with just healing on a day-to-day basis. Other things that many of us have maybe used or been told about are cortisone or steroid-based injection-based therapies or oral therapies like prednisone. While these can be helpful in the short term, they are strong anti-inflammatories. They can help with pain related to arthritic conditions, inflammation, tendonitis, bursitis, irritated nerves, and are used very commonly for those types of conditions. What we're not always told is some of the complications that can arise from recurrent corticosteroid treatment. Obviously, for diabetics, it can be problematic in that it elevates your blood sugars. Some people are sensitive and gain weight, flushing, anxiety. In your tissue, it can be associated with toxicity to tendon and cartilage cells, especially with repeat dosing, which is why a lot of doctors want you to only get 3 a year, or even that over time can be toxic and detrimental to your joints. Corticosteroid use is associated with the faster progression of osteoarthritis, associated with osteonecrosis, so death of the bone, rapid joint destruction. Things that aren't always discussed in an informed way when we're getting these treatments on a regular basis. So it's important to know that it's good to find alternatives to, substances that are destructive long-term, even though they might be helpful in the short term. We're going to learn that a lot of our philosophy is what can we do to preserve tissue as opposed to provide short-term benefit, but long-term detriment through destruction and toxicity, or if we can prevent surgical removal of tissue, again, as long as we feel it can be helpful. We'll talk more about how we decide who's a candidate and who's not. Then that's just better for everybody. So just some specific studies that have looked at corticosteroid injections and some of the risks with the use of these for joint issues such as hip arthritis and knee arthritis. We all know that surgery is a common option for orthopedic conditions, whether it be spinal surgeries like fusions, which is what's depicted on the screen, or knee replacements or rotator cuff repairs or other types of surgical intervention. Well, again, some people do need these, and sometimes these are the right choice. Again, sometimes people don't understand that they're opening the door to a large potential for different complications. So for example, in lumbar spinal fusion, depending on your age, complication can be up to 30% if you're older, or more minor complications are included 60% of patients, which can range from infection, tears around the sac that surrounds the spinal cord and nerve roots, vascular injury, hardware being placed in the wrong position. And this is not even discussing continued pain medication use, reduced function activity, future surgery from adjacent segment degeneration, so areas around fusions and things like that. So again, just being aware of what are my options, what are the risks and benefits, what are the alternatives, and then you start to have a better ability to pick and choose what makes the most sense based on all these factors. Just going more, knee replacements can have, a 16% complication rate, which can range from death, infection, pulmonary embolism, blood clots, surgical revision. Again, some people need that type of surgery, but again, are we in a state where maybe there's alternatives? Knee arthroscopy can carry a 5% complication rate. And we have to remember that surgery is not universally effective, right? So even knee replacements, which is a very effective surgical intervention, not everybody gets the full function. And the only randomized study compared to physical therapy showed that it takes 5 knee replacements to find one person that did 15% better than physical therapy. So it's not always as effective as it seems, although many people do get better. Now, when we compare some of these complication rates versus the injection-based procedures that we provide, which obviously is less invasive, so it's always going to carry a lower risk. But we published basically a 10-year study that looked at 2,300 patients that underwent autologous stem cell injections for orthopedic conditions with a complication rate of 0.17. So significantly lower than these other more invasive options, which should make intuitive sense. A lot of this is just the natural evolution of more information, more technology, better understanding of things, and a lot of what we do is just trying to advance that as more information comes out. So Regenexx has been around since 2005. Again, growing out of the need to find alternatives to cortisone and surgery. All of these things are destructive processes, and part of the goal is to find things and take advantage of mechanisms to help preserve tissue. Regenexx now is a large physician-based network with, I think even now, there's probably 80, 85 clinics around the United States. Obviously, we're one clinic that's part of this larger network of physicians. And we do have some international locations as well. The process has always been innovation, research, patient outcome tracking, which we'll talk more about. That's very important in making decisions on who's a good candidate, who's a not good candidate, what's the complication rate, what's the outcome and successes. We publish lots of research, and we use all this data to continue to educate people, patients, physicians, and publish research. And again, this is just utilizing information to help advance medicine, at least in the orthopedic realm, which is where we're focused exclusively. So a lot of what we do is minimally invasive injection-based procedures. So it's needle-based procedures being precisely placed where we can inject and utilize healing factors that we extract from blood, from platelets, growth factors, bone marrow concentrate, which contains mesenchymal stem cells, again, with the goal of preserving tissue and reducing the risk to more invasive options. So a lot of what we inject is called orthobiologics. Ortho for orthopedic, and biologics we're using cells that have biologic properties that our bodies already naturally are accustomed to seeing and responding to. But it's good to have just a basic foundation, understanding that we do have the capacity and mechanisms to allow our bodies to respond to injury, to create new tissue, whether that be from injury. So we cut ourselves, we bleed, we have a mechanism to stop bleeding, we have cells and growth factors that trigger healing responses to help skin, collagen, and everything kind of reform into that area, right? We fracture a bone and we can grow bone in the fractured site. We have surgery. You still need to heal from the invasiveness of the surgery and whatever was done. And so we do have components of our bodies that we can take advantage of to influence and kind of improve the healing responses in tissues that are maybe having some trouble in healing. A lot of degeneration has many factors in why our joints or our muscles or tendons or cartilage wear down. A lot of it's a supply and demand mismatch where the demand on the tissue supersedes our ability to maintain it. And while we do have reserves to try to help do that over an extended period of time or through traumas or traumatic type injuries, our body needs to be able to deliver the right signals to help kind of repair that tissue. But we do have cells within our blood. We have proteins and growth factors that help maintain a balance of homeostasis and inflammation. We have stem cells found in different tissues that can be harvested and concentrated and utilized in other areas that are maybe deficient in the reserve. So for example, we utilize platelet-based therapy a lot, which is called PRP, platelet-rich plasma, for a lot of the orthopedic conditions that we see depending on the severity. Now, platelets are important. They have many functions, one of which is to help with controlling bleeding. But the other function is to activate healing. So there's many growth factors that are found housed within platelets. And once a platelet is activated in an area of injury, it releases these growth factors to stimulate cell growth, new blood vessel growth, collagen production, and to recruit other cells to the area for aiding in the healing process. We tend to utilize PRP, platelet-rich plasma, for mild to moderate arthritis, tendonitis, bursitis, small tears in tendons, ligaments, muscle tissue. We utilize it a lot for spinal conditions like joint arthritis in the spine, disc herniations, disc tears, things like that. So it's an important cell that we utilize. We'll learn that there's lots of studies comparing platelet-based therapies for orthopedic conditions compared to cortisone, gel injections therapy, bracing, and in some cases surgery. So we also have proteins called A2M that are really big, strong anti-inflammatory proteins with the ability to reduce swelling and cartilage breakdown in arthritic joints. And there's some comparative studies with this versus steroid injections and versus PRP for helping reduce arthritic pain and inflammation. There are mesenchymal stem cells that can be utilized for orthopedic tissue maintenance and healing. One major reserve and reservoir in our bodies is the bone marrow. You can also isolate mesenchymal stem cells from adipose tissue, but it takes a little bit more to release them, which has some FDA, compliance issues that we can discuss. But we utilize these cells, which again in the lab have different abilities to transform based on their environment into different tissues. So cartilage, bone, muscle, So a lot of the orthopedic type tissues, which we'll utilize for more severe arthritic changes, a little bit larger tears to a certain size and rotator cuff tears or muscle and tendon, more significant degenerative changes of the spine. Those are the types of conditions that we might lean more towards this as the right option. Now, this is just a brief summary. It's a couple years old about a lot of the research out there utilizing stem cell-based therapies for orthopedic conditions, dating back to the late 1990s through 2021. There's obviously significantly more since 2021. All of the yellow studies are studies that Regenexx has published. And so there's quite a bit there. This is just you looking at bone marrow-derived stem cells for orthopedic conditions. Again, studies that Regenexx has published. Looking at randomized controlled studies, comparing platelet-based therapies versus other interventions for knee arthritis, meniscal tears, hand arthritis, hip arthritis, vascular necrosis, gluteal, shoulder issues, carpal tunnel, elbow epicondylitis, lumbar issues, SI joint, Achilles, ankles. So quite a few, greater than 100 randomized controlled trials looking at random platelet-rich plasma compared to other intervention, showing benefit against the alternative in almost every study. Specifically for knee arthritis, lots of studies utilizing PRP and stem cell therapies. And so that's just to highlight that there is data. Obviously, there's always a need for more to kind of better understand candidacy and people, what the success rates are, which is why we have, a more in-depth process in trying to educate people on their orthopedic condition, discussing all of the different options, and then more precisely, if we felt some of these orthobiologic treatments were helpful, how do we process and then how do we deliver these into the right area to maximize the outcome? Again, we focus only on orthopedic conditions. So the process in trying to predict and understand your condition is very important. These are all medical procedures. So understanding what the condition is the first step in deciding what the treatment should be and what the potential for success is. And so we do this through a comprehensive consultation. As I mentioned, we do have a big registry where we're currently tracking 80,000 patients that we've treated over the years, and an ongoing registry tracking patient outcome, pain reduction, functional improvements, and complications. And then also our research and all available research to understand what's being published. Our consultations are comprehensive. Everybody gets at least an hour consultation. It's in time to get to know the problem, get to know your medical history. We go over imaging. We do have ultrasound in the clinic for peripheral issues. If we have MRIs, we'll go through that. It's important for you to understand what's going on and that, you have confidence that I can describe what's going on and explain it for you to understand. And we do a comprehensive physical exam, again, to know exactly what's going on, what your functional limitations are, because that can play a role in what the treatment recommendations are as far as physical therapy and activity modification. It's also how we develop a treatment plan, right? If we don't know what the problem is, how can we pick the right tool for your problem? Again, part of this is understanding that we do have a big registry for neck, elbow, foot and ankle, hand, wrist, hip, knee, lumbar, spine, shoulder. So it tracks patients at least over 4 years to look at these different outcomes. Part of the prediction is also understanding our research, which is published on our regenexx.com website, clinical studies. We are our medical headquarters in Colorado is recruiting for a low back lumbar disc degenerative study utilizing PRP. So if people are interested in that, I can try to get them more information. But we have to understand the research. And then all of this helps us determine if you're a candidate for what we do. Are you a good or high responder, a moderate responder, or a low responder based on all of your characteristics of medical history, your other medical problems, your orthopedic condition, and what the physical exam shows. Now, every part of the body can have some unique characteristics that might push people in one group or the other. So there's no like just basic, a lot of people ask, well, what's the outcomes? What's the responder rate? Well, it just depends on your condition. So you can't really give an average success rate without understanding what the specific problem is. But these are the conversations we have in the consultation to help people understand what's going on. And then we do have a thorough conversation on all available treatment options. Now, once we say we think PRP or a bone marrow-derived stem cell treatment's useful and that you're a good candidate and we feel this can be beneficial, you have to have a good process in how to customize the concentration, the dose for the problem. Because every person we see is unique. Sometimes we'll see someone that's 20. Sometimes we'll see someone that's 85. Some people have mild issues. Some people have severe. Some people need their disc injected. Some people need a tendon injected. All of these different things might need a different type of concentration, dose, preparation. And so it should not be a one-size-fits-all approach. And so we do have a lab platform that allows us to customize manually different concentrations, preparations. We can make different products all at the same time for different types of issues being treated in the same session. And we do hold multiple patents for processing and cellular isolation techniques, so that people get a more customized treatment, as opposed to a lot of clinics utilizing a one-size-fits-all bedside centrifuge that can only do one thing and can never do anything else, and won't be able to adjust dosing based on the condition, the age, or the injury severity type. Now, once you have all those nice cells to utilize, you want to be able to deliver them properly to the right locations. Contrary to what some people might say, a lot of these things have to be delivered very precisely to the problem area, and they don't just somehow find their way to the area. So as an example, this is an X-ray procedure for a knee injury where there's cartilage loss underneath the kneecap. Osteoarthritis is basically what that represents, and a kneecap bone lesion, contusion here, we'll call bone marrow edema, bone marrow lesion. And we can see precisely the needle placement where the cells will be delivered. So we know that we're going to maximize this person's potential for improvement by getting the cells right where we want them to be. An example, utilizing X-ray for a labral issue and a shoulder joint injection. Utilizing ultrasound guidance for carpal tunnel and injecting platelet growth factors around the median nerve at the wrist. There's quite a few studies looking at PRP for mild to moderate carpal tunnel being very effective and improving nerve conduction. Study parameters being more effective than corticosteroid injections. And so that's kind of what we feel is very important when people are exploring alternative options for their orthopedic condition. Is we want to make sure that we have a good process and how we're evaluating your medical condition, your orthopedic condition, that we understand and have a good sense of what your potential for improvement can be, that we have the most customized, flexible platform to deliver the proper dosing and the proper type of solution. And that in the end, we want to get it to the right locations to help maximize the overall potential. Now, procedures for, say, PRP, for example, which we call SCP, is a one-day procedure that involves blood draw, processing, and injection all on the same day. The process is we always use X-ray or ultrasound guidance for the injection. People do feel sore for a couple days. There will be some recommendations on activity modification, physical therapy. Now, again, it's hard to give a general outline because it just depends on your condition. In general, we'll recommend 2 weeks of low impact activities, followed by a progression to get to full activity after that. And then we follow up people every 4 to 6 weeks to assess improvements. How are you doing? There are always some people that need more than one treatment. I would say the highest repeat injection area is probably the spine. So it just really depends on the severity. If you have more severe, say, degenerative changes in your knee, you might need more treatments than someone that has mild. So it kind of just depends on what the underlying problem is. But we have a follow-up process to ensure people are getting better and to continue to reevaluate your overall response. When we're utilizing bone marrow-derived stem cells for orthopedic conditions, more degenerative arthritic joints, we do have a multi-step process to help facilitate a response, followed by the stem cell treatment, followed by a platelet growth factor treatment. Not everybody's going to need this. A lot of people, I guess I don't have it here. A lot of people will ask about the bone marrow aspiration, because that's where we tend to get your own cells. We're going to talk about, FDA does regulate what types of stem cells we can use for orthopedic conditions. There's compliant and non-compliant sources. In the US, people are utilizing the non-compliant sources, which we are not. We are only using compliant sources, which are the bone marrow-derived cells. There's large studies that look at safety and outcome. 90% of people rate, as long as you use proper local anesthetic, the bone marrow aspiration procedure like a 2 on the 10 pain scale. So in the mild range, there is some sensations, but it's not typically a moderate or severely painful condition or procedure. It's done in office. We can utilize twilight sedation. We do have nursing that comes in to assist for that. But even without twilight IV sedation, on average for 90% of people, the pain level is about 2 out of 10. Takes about 30 minutes to perform that procedure, and then these cells are isolated, counted, and viability is checked, and then we re-inject the same day. Now, we do want to just briefly talk about, it's essentially just that these are medical procedures. Not everybody's a good candidate. Not every tissue can be regrown completely. If you're completely diffusely bone on bone, you're not growing new cartilage when you get stem cell treatments. Pain can be complex. I've seen people with bone on bone joints that have no pain. So pain is not necessarily always related to cartilage loss. Having said that, you're not going to completely regrow cartilage if you don't have any tissue to work with. And so that's not always the goal. Cartilage is avascular and has no direct nerve input. So the loss of cartilage in of itself is not a painful phenomenon until other things around the joint start to become irritated with inflammatory chemicals. The bone gets irritated, the synovial tissue. But it is important to know there are limitations with what can be done with these which all medical procedures, medication, surgical intervention have, right? So you want to make sure that you don't fall into the hype that everything can be treated completely with any of these types of therapies. And just to point out, FDA does regulate these things. We're not going to talk about all these different regulations, but we have to understand what they do find compliant, because they can come in and take your license away and shut you down. So we have to be aware that they do not approve umbilical cord stem cell products for any orthopedic use, and people utilizing them are non-compliant, which again just puts them at risk. Doesn't mean people can't benefit from them. It just means that we have to be cautious about the types of cells we use and what that means for patient education and understanding what the potential is. There have been recalls and different issues with umbilical cord issues in the United States. Obviously, outside the country, there's a little less regulation where people can have more access to different sources of stem cell treatments, typically derived from umbilical cord blood or Wharton's jelly, then cultured and grown over time to purify it, which that whole process is not allowed in the United States itself. And there is definitely a lot less data utilizing umbilical cord stem cells, and so that's why we're not specifically using them at this point. Now we do have other options in the clinic that are non-invasive, just to assist with healing, inflammation. So we have a class 4 laser, kind of a high-level laser with higher dosing. We tend to use it just for more muscle strain, sprains, inflammation, or post-procedure recovery. We do have game ready system. We have those types of things to, again, just help with recovery and healing for muscle strains, post-surgical swelling, post-procedural swelling. So I do want to get to the question and answer time. I don't see anybody's written down any specific questions. If you do want to take time to do that, I did have someone email some questions earlier, which I might have covered a little bit. One of the questions was, how painful is the bone marrow knee procedure? Have patients provided information regarding this using the 1 to 10 pain reference? So as I mentioned, bone marrow aspirations can be comfortable even without IV sedation. You have to allow enough time for the local anesthetic to take effect. 90% of people rate that portion of the procedure 2 out of 10. The re-injection into the knee is not that much more painful. Again, we still use local anesthetic, ropivacaine, which is safe around cellular therapies for an anesthetic effect. There can always be pressures and some sharp areas that are a little more tender than others, but very well tolerated. Do many patients opt to have, additional sedation? So yes, some people do choose to use like IV twilight sedation, which is an added cost. It's $300 in the clinic to have that. A lot of the PRP and bone marrow derived treatments are not covered by insurance. Most insurances. Our organization is the only organization that has large employer contracts. So we have 2,000 self-funded companies that cover Regenexx procedures for their employees. And so they do have coverage through their employer health plan, but most private insurance companies and Medicare don't cover it on a wide scale basis. So there is a self-pay portion there. Says, in the video on success rate of the knee procedure, it is stated that patients sometimes get a follow-up procedure. If a follow-up procedure is chosen to reduce pain, what is the cost? A lot of that's just going to depend. There is a 30% reduction in cost depending on what you're doing, so it just depends. Like I said, the overall repeat injection rate for spines is higher in like the mid 20%. Again, that depends on your severity. For other joints, it might be 10% or less, need more than one treatment. So, but there is a reduced cost if people needed to do that. But, those are things that we kind of highlight when we're talking in the clinic for the evaluation to say, okay, this is what we expect your outlook to be. But it is true that not everybody gets completely better with one treatment. So, um, we all have to understand that and understand what that could look like. Some other questions about a meniscus tear, but no pain. Do I wait until it presents with pain to start PRP? Okay, that's kind of difficult. As far as like prevention, because it's more of a prophylactic treatment in your case, given that you have, I wonder what led to the MRI if you don't have knee pain. Were you just looking at the joints? Because we can, depending on your age, if we just took 100 people, mid-30s or above 40, roughly 2/3 to 70% of those patients will have some level of degeneration or meniscal tears on MRI that have no pain, that may never have pain. So then you have to balance, the cost of the procedure and what's the purpose of the procedure. One, can we heal the tear? Does it look like you are having advancing degeneration? Do you intermittently get symptoms? Do you get stiffness? Things like that that we could potentially look at improving. So, there's some data that shows that PRP can be disease modifying and preserving joint cartilage. So there's some more longitudinal studies that looked at groups with natural degeneration versus those treated with PRP in knee arthritis, with the PRP group having better preservation of tissue over years. But, I'd probably have to look at the MRI to see what's the extent of the meniscal changes to see if it even makes sense, because injecting a needle, even with PRP, carries some level of risk, right? That complication study that we did, the complication rate wasn't 0, right? So when you're poking around, with unknown benefit, how much is it worth doing an injection? So, it's just things we'd have to kind of discuss and really look at the structure to see if it's something that looks like it would be amenable to treating and actually improving. What is the cost of the bone marrow treatment? So a lot of the bone marrow treatment starts at about $4,800. Just depends on how many sites and things you might need. It can go up from there. If you want sedation, though, all those types of things. A lot of those specific details would be obviously given to you once a full evaluation was performed, to make sure you understood everything that was involved. Says, if coming out from the country, what is the time frame to stay post-treatment? After that, we would like people to stay at least 48 hours post, say, a hip treatment, because you are going to be stiff and sore for at least 2 days. So that's kind of the minimum requirement, especially if you're flying from out of the country. So it's good to have at least a 48-hour stay post-procedure. So the bone marrow treatment, like I said, the cost for hip or knee, it's all pretty similar. Just depends on if you need multiple sites treated and if you need sedation or other pre or post injections. Another comment, I had 2 episodes with severe knee pain. It lasted only 1 or 2 days. Okay, so that was for the meniscus. Yeah, I think there could potentially be a benefit to it, but it'd be good to just look at your MRI. Other options would be a high hyaluronic acid gel injection, which is hydrating and lubricating to the joint, which also has some insurance coverage, which would be a potentially other option, which is also shown to help protect the joint. And so that could be another option, but PRP could be as well. what is the cost of an MRI for hip? Well, a lot of it depends if you have insurance or not. If you don't, then we have some some contract or some negotiated rates with a couple places where a hip MRI would be $185 to $200 if you're doing self-pay outside of insurance. Would you do PRP and bone marrow together? Yes. So when we do bone marrow treatments, we always combine it with high concentration, 14 times concentrated PRP. So that's just what I put those together for the final inject date. What if you do not have any imaging or x-rays? So yeah, people can still come in without imaging. I can evaluate people to make sure we're going to order the right images. So I can order them. I am contracted with most insurances for those types of things to be able to bill. Or again, we have the self-pay rates where we have negotiated rates with different facilities that aren't, outrageous. We do have ultrasound in the clinic, which I do utilize a lot for knees, shoulders, hips, feet, ankles, hands, that I can get a sense of some things, but some things do require MRIs. But I can order those, and then we can schedule a follow-up to review that, and then help, again, determine your candidacy and what your options are, the potential for success. Right hip, labral tear, dysplasia, impingement, tendonitis, no arthritis. Yeah, I mean, depending on how bad the dysplasia is and how bad the labral tear is. But yeah, tendonitis tends to do pretty well. The cartilage, if you don't have a lot of arthritic change, can be helpful. As long as it's not a displaced labral tear, which if it's displaced, no injection will really help that much. But in general, it seems like PRP could be a reasonable treatment for that type of situation. I'll just give another second to see if anybody else has more questions. So the cost for consultation, if you don't have insurance, there's a question, what is the cost for a consultation? If we're just doing up to 2 sites, which is an hour long, it's $100. If you have more than 2 sites and it's a 90-minute consultation, it's $150. Or if you have insurance that we're contracted with, then we bill your insurance and we just collect your typical copay. Question, have you ever used this to help with fibromyalgia? No, we don't have any specific data on just treating fibromyalgia. Now, sometimes people with fibromyalgia also have other orthopedic issues that can contribute to pain. People with fibromyalgia can have arthritis or tendonitis or, other things like that we could potentially treat, but it won't help specifically like diffuse pain everywhere. So we haven't like specifically just treated just fibromyalgia pain with it at all. Question, how much is the gel injection for a small meniscal tear? Again, that can be covered by insurance if you have it. Again, that just depending on your deductible and your co-insurance. The cash rate in our clinic is $500 for a gel injection. It says, once you have a consultation, what is the time frame to start treatments? A lot of it depends. If people are, it's usually a week or two, unless you have things that are going to delay it. So if you're on blood thinning medications, if you're taking cortisone or prednisone or had a recent steroid injection, then they can be 4 weeks. Because we want that stuff to get out of the system because it can affect the overall outcome. Obviously, if you're on blood thinners, it's going to depend on the type and getting clearance from your prescribing physician. if there's ibuprofen and Aleve need to be stopped for 5 days before the treatment. So if you're taking those very consistently, then that can create a little delay. I'm going to put this up too. This is we do have a patient education center that we work with to help kind of educate patients if they have more questions or to get them scheduled. So this is just the email for Danielle and the phone number if people have more questions. If people want to send in their MRIs or imaging for me to review before scheduling a consultation to see if there is, you know, a benefit in coming in for a full consultation, um, you can do that. There's no charge for MRI review just to see if there's options. Um, like I said, there's no really downside to the consultation. We do a lot of education. We help you understand what's going on structurally and help you understand all the options, whether it be surgery being the right thing, therapy, gel, corticosteroid, any orthobiologic. So people can get a lot of useful information that they maybe wouldn't get elsewhere because we just have more time to dedicate to that conversation. Where sometimes you go to your orthopedic doc or your primary doc and you only have 5, 10, 15 minutes, and that time can go by quick and you don't always get as much information as you might like. So there's no big downside to coming in just to understand all of your options. All right, it looks like that's all the questions. Like I said, reach out to Danielle or to us if you have other questions or want to get more information or get scheduled or get your information to us for review. I appreciate your time. It's already been almost an hour, so just me talking. It's always hard on the webinars because I don't get to see you guys and interact. But again, I appreciate your time. In the future, we continue to do these. We'll do more site-specific ones like low back or like spinal issues or knees or shoulders, those kind of things. But be on the lookout for those. Otherwise, appreciate your time and enjoy the rest of your evening. Thank you.